Study cloud.
Halo, Assalamualaikum. Boleh boleh dengar suara saya ke?
Ya, Waalaikumsalam. Boleh dengar, Prof? Okay.
Okey, saya salah masuk link tadi. Okey.
Oh, okey.
Halo, Assalamualaikum.
Okey.
Salam.
Okey, okey, Prof, eh? Okey.
Halo, Assalamualaikum.
Okey. Ya, ya, boleh, Prof. Okey, Prof, kalau tak ada apa-apa, insya-Allah kita boleh mula, Prof.
Okey. Saya try to share slide saya. Kejap.
Okey, Bismillahirrahmanirrahim. While waiting for the Prof to test the slide, so I would like to begin our session today with Kitab Al-Fatihah. Alhamdulillah, we are grateful to Allah Subhanahu Wa Taala for giving us the opportunity to gather this morning for our CME session with topic on update on vaping cessation. Okay. So we will conducting several activities, including CME session, public health webinar, health exhibition, okay, video presentation, okay, smoking addiction screening, and smoking cessation counseling. Okay, so we would like to join us throughout this week at our family health clinic. So today we are very fortunate to have a speaker who is highly experienced and well recognized in this field, Professor Harmi. Okay, so allow me to briefly introduce Professor Harmi. Professor Harmi is a senior consultant and senior lecturer in family medicine, currently serving as the Dean of the Faculty of Medicine at University Sultan Zainal Abidin Uniza, Kuala Terengganu. Okay. He has extensive experience in academic leadership, practice, and medical education. Okay, so his research interests and publication focus particularly on smoking, vaping, tobacco-related health issue, okay, with active involvement in national level advocate and research initiative. Okay. So without further ado, Prof, I would like to invite Professor Hamid to.
Okey, Assalamualaikum warahmatullahi wabarakatuh and very good morning. Thank you, Khairul. Cuma Khairul saya tak boleh nak share slide ni, tapi saya ada bagi PDF to your
Uh,
WhatsApp. Mungkin you boleh
okay, ya, ya.
upload from your side kan?
Okay, ya, boleh, Bro.
Okay. Before that tu I boleh use I start my presentation first, but you can share with them with my slide lah. Okay,
Okay,
thank you very much for this opportunity to share with you all about smoking, particularly vaping update. And then I will begin my presentation by telling you about the some history of vaping, and then try to classify a different type of generation of vaping, the system, and then the type of nicotine and what is their implication in term of the addiction and the clinical apa tu implications lah. And then recognize vaping as a new endemic, analyze the danger of vaping, and finally try to find is there a new approach in vaping cessations. As we know that e-cigarette is actually electronic cigarettes are devices used to store, to heat, to vaporize, and inhale of an aerosol containing a polypropylene glycol or vegetable glycerin, flavor, and most cases nicotine with or without other chemical. So these are uh, the different type of e-cigarette. For example, we have hookah, we have what we call it churut, and a conventional type of uh, devices like smoking like or cigarette like devices. But nowadays it evolved to a different kind of devices. And according to WHO, they divide this electronic cigarette to two types. One, we call it the electronic nicotine delivery system. The second one, we call it electronic non-nicotine delivery system. So if it contains nicotine, we call it a ENDS, electronic nicotine delivery system. If it is not contain nicotine, for example, some country like Japan, so Japan, they prohibited nicotine in vape. So people can sell vape but without nicotine. So we call it the ENDS. But in our country, most of the time, all these devices will contain nicotine. Although last time some of them claim that they are not contain nicotine, but when we did a study, majority of the devices or the solution actually contains nicotine. Okay, next slide. These are the different kind of devices. So this one, the big one, is actually the third generation of devices. Even the worst part is now they can make the devices to the more child friendly. So this is a very dangerous because of the child or the parents might not aware that their children actually vaping because of the gadget is just like uh, uh, very friendly to the children. Ni macam mainan je lah, Doraemon lah dan sebagainya. Okay, next slide. A little bit on history. So this is not something new. Actually, Joseph Robinson from US developed the first idea of ENDS in 1927. But when in 1965, Herbert Gilbert, another American, also filed. This is the first document that being filed or being copyright. It's by Herbert Gilbert in 1965, and this is their apa tu, what you call it, their illustration on the devices. And Phil Ray and Norman Jacobson first commercialized it, but they're facing some problem. They cannot make it. They cannot sell their product. And then finally, next slide. China guy, this is Holding in year of 2000 through the European company sell to public. But in Europe, started 2009, there is a what we call it, worldwide sales of these e-cigarettes. Okay, next slide. These are the mechanism. You have to understand the anatomy of the e-cigarette. They have what we call it cartridge, microprocessor or atomizer, and then this one the appearance of the this is the first e-cigarette. They just mimic features of conventional cigarette, but nowadays the features is totally different. But the components, the battery, the microprocessor, and the cartridge are still the same. Okay, next. And what you need to understand in terms of the device, so now they have come to the fourth generation. So the first generation, just like the cigarette, second generation where they combine the atomizer and then uh, the cartridge. The third generation, they have the big container. Then the fourth one, the most of the fourth one actually they make it more simple but more powerful because a different generation of vape will give you a different power of vaporizing the solutions. So the higher they vaporize, so the more absorption to the lung. So that's why the newer generation, so they are more effective in terms of making the nicotine absorption to our body. Okay, next slide. The second thing that you have to understand, one, we call it a closed system. Second one is open system. If you can manually refill the device, so we call it the open system. So the closed system where you cannot manually refill the cartridge. You need to just throw it away when you finish using it. So in terms of safety, the closed system provide a better safety because of it reduce the risk of liquid exposure, especially to the children. But for the open system, the chances of the solution because of you can refill, then you will buy the solution separately. But the risk of the children, for example, getting the solution and develop the nicotine poisoning is very high. But the newer generation mainly focus on the closed systems. Okay, next slide. On top of that, another thing that you have to understand, the different kind of nicotine being used in the vaping. The earlier generation or last time they tend to use the free base nicotine, but the newer generation of vape they tend to use the nicotine salt or the acid based nicotine. So what are they different? The different free base nicotine is more alkaline, and then the acid base is a more acidic. Free base nicotine is more cause irritation to the to the throat. That's why people will not take it or use it for a high intensity or high dose as compared to the acid base, where acid base it is less irritation. The second thing that you have to understand, the free base nicotine less effective in terms of absorption compared to the acid base or nicotine salt. They are more can be absorbed better compared to the free base. For example, to reach the peak for the free base nicotine, it required about 10 to 20 minutes. But for the acid base, you can have the peak of the nicotine concentration after you start vaping less than 5 minutes. Less than 5 minutes. So that's why the risk of addiction is higher in the acid base or nicotine salt compared to the free base. These are the strategy of the manufacturer where they use the more effective delivery and absorption of the nicotine to make sure that people who take it will have the chance to or higher chance to being addicted to the nicotine compared to when they're using the free base nicotine. So, and you understand the different kind of devices, different system and different type of nicotine being used. But nowadays, majority of the vapes or the solution being used using the acid base or nicotine salt. Okay, next slide. Okay, now because of that, what we notice, the number of e-cigarettes increasing. For example, in 2011, the number worldwide about 7 million. But in 2024, this is based on WHO, they estimated at least we have about 100 millions of e-cigarette smokers. So that's mean within 13 years, the number is increasing more than 12 times, right? This is not at this moment there is no big study on the prevalence of vape. This is based on the estimation by WHO based on the other study. So they estimated. So another meta-analysis found that the lifetime prevalence at 23% and current prevalence about 11% across the globe. Yeah? And then countries that using vapes, for example, US, Europe, Asia, and Oceania around 10 to 14%. And in some countries, the problem is among the adolescents. So among the adolescents, can as high as 46%. Okay, next slide. These are the illustrations. You can see that the numbers of vapors is increasing tremendously over 15 years. Next slide. Uh, in the global trend, we can see the prevalence of smoking is reducing. So now the prevalence worldwide around 18%, but the problem is number of vaping is increasing as a replacement to the conventional cigarettes. Next. And then this is based on the continents. You can see that the Europe still high, followed by the Asian country, and US, America. Okay, next. In Asian country, we notice that the highest prevalence in Indonesia, this is ever vapors, and 11.8% the current vapors. And then the lowest in Japan, about 2.1 to 3.5% ever vaping, and then the prevalence of the current vapors is around 0.7%. I have a colleague in the National Environmental Institute in Japan, so we asked this phenomena. So the answer is because of Japan, they prohibited the nicotine. That's why most of the vape in Japan, if it is sold legally, it is no contents of nicotine. That's why they are not. This is evidence that without nicotine, people won't hook to the vapes. Why they are addicted to the vape because of the nicotine. Otherwise, in Japan, you can see it's less than 1% of people who are vapes. Okay, next. This is a Malaysia, scenario in Malaysia. In 2011, the prevalence is 0.8%, but in 2023, this is based on NHMS. We found that the prevalence about 5%, so the number about 1.4 million. So this is a 600% increments of the vaping prevalence among our population. Okay, next. Among you can see here the current the difference between the current cigarette smokers and then the e-cigarettes. You can see that the numbers is actually start higher among the e-cigarettes users. Okay, next slide. Next slide. These are the reason based on the study. These are the reason why people like to vape. So previous slide. Slide sebelum tu. So most of them like the taste and smell of the cigarette because you can get whatever flavor you like. In Malaysia, you can get the flavor of vanilla, strawberry, budu, nasi dagang, all sort of flavor. They can enjoy it. So because of last time, before a new act, so industry of vape is a backyard industry. People can just add whatever flavor they like to suit the needs of the customer of the vapor. So they wanted to experiment the e-cigarette because it is new gadget. It doesn't look like very harmful like a cigarette because of they cannot feel the heat, right? They cannot feel the heat. They cannot see the fire, so they feel that e-cigarette is safe as compared to a tobacco cigarette. So and then it's very trendy. Sometimes easily offered by the friends or family members. Dan sekarang ni kalau you notice in children, so they can easily get the e-cigarette through online, through friends. You can rent the devices. Kalau tak mampu kan nak beli RM20, you can rent about RM5 for 2 days or 3 days. This kind of uh, okay. And then there's another study. The answer from the student, they said that in vape there is no nicotine, flavored, rasa manis, boleh guna lama, senang nak dapat, kedai berdekatan sekolah, tidak punya air tembakau, lebih jimat, boleh pakai lama, very apa nama ni, handy, cantik, boleh buat collection, tak berbau. Some parents kan, they not even notice the children is actually vaping because of you can simply keep the devices in the apa nama school bag tu, dan tak ada orang actually yang aware that you are actually vaping because of uh, their mouth is not that smelly as compared to cigarette, right? So that's why they can easily hide their behavior from the parents. Okay, next. The mechanism of addiction is still the same. So it goes to the ventral tegmental area, and then it stimulates the mesolimbic system. Then it creates the addiction cells, right? Because of the stimulation to the nucleus accumbens, and cause a reward system here. So, but not as effective as cigarette because, as I mentioned before, the absorption is a bit slow. But with the new nicotine salt, so the absorption can be very fast. So that's why the new generation, the chances to get addicted is higher compared to the compared when they use the free-based nicotines. Okay, next. So the danger of devices, as you know that. So the devices can be one, the fire. It can cause fire. So it can explode. Eh? So and another
Oh,
thing that
asma. Patut ni.
and it can also cause environmental pollution for those who concerned about the planet, planetary health. So it causes the microplastic pollution. The remaining of the chemical can cause chemical pollution, on top of the risk of nicotine poisonings. These are some of the content in the solution. The main one is a propylene glycol. Why they use propylene glycol? Because it can be easily erupted, vaporized at the temperature of 60 degrees Celsius. That's why the microprocessor just create the heat of 60 degrees Celsius, and you can vaporize the propylene glycols. Vegetable glycerin, these two normally used in foods, right? But we are not very sure when we heat it whether it creates the byproduct that can endanger ourselves. Right? The coloring, the flavor, and some of the solution contains of the carcinogenic like anabasine, nitrosamine, B-nitrosamine, and so on. Okay, next. These are the propylene glycol, the short-term effect, irritation to the eye, throat, and respiratory tract. Next. Long-term effect, when heated, it will produce the substance that release formaldehyde, and formaldehyde is actually cancerous, and can also exacerbate the asthma. Okay, next. And propylene glycol can also narrow the pulmonary vessels. So can cause a pulmonary hypertension in long run. Okay, next. And then because of lack of product control, the act just introduced last year. So at this moment, we can still have thousands of brands and no proper regulation, no proper control of the products. So that's why the solution, the what we call it, the concentration of the solution can be very different, either from the label itself. The label may indicates that the solution is a content of 10 milligram of nicotine per ml, but in actual solution, so it might be more than 20 or 30 milligram per solution. Okay, next. Another things that because of this device, so the chances for people to add drugs to the solution is very high. So that's why vape being used to introduce the illicit drugs. And based on the study, things like ketamine, penicillin, marijuana can be put in the solutions, and people enjoy it. And people uh, might not aware it because of they just look like a vaping uh, normal solutions. But actually it contains the illicit drugs. Okay, next. Ni mushroom kan, pernah dengar tak magic mushroom? So they use this solution, the magic mushroom, and we don't notice it until the children or the adult can develop the symptom of magic mushroom. Magic mushroom actually contains of uh, psilocybin. So it is a serotonin receptor. They actually act at the serotonin receptor, specify H2A, and cause like the hallucinogenic effect lah. And sometimes people can develop fit and severe fit. So that's a symptom of a magic mushroom. Okay, next. This is based on study. Ada dalam tu ada dadah. So, and it's quite common nowadays kan, report by anti-dadah kan, kita punya AADK, number of magic mushroom apa tu quite rampant lah actually among adolescents. Okay, next. Okay, same thing. Next slide. This is what I mentioned earlier. The vape industry is a really big yet industry, so a lot of people venture on it, and then the sale is very good. You can type in the Google Map the vape house or vape shop, then you can easily find a lot of vape outlets around you. Okay, next. So second thing on because last time, in my time, we don't see nicotine poisoning. But nowadays, the reported nicotine poisoning is increasing. So you as a family medicine specialist, you need to study, you need to understand on the nicotine poisoning, because of you might be facing a nicotine poisoning case. And I just talked to my friend in Pusat Racun Negara. So the number of nicotine poisoning from 2015 to 2024 is increasing more than five times. And the number of people calling to get advice for nicotine poisoning also increasing tremendously. But of course nowadays a bit less because of they tend to use the closed system. So if you use the closed system, or the what we call it, the uh, kita panggil apa yang pakai buang tu, disposable, then the risk of uh, nicotine exposed to the children a bit less. These are the effects. So if the children, for children, if they ingested 10 milligram of nicotine, it can cause death. And then the solution sometimes contains of 60 milligram to 100 milligram. So if children accidentally drinks the solution, so it can cause a severe nicotine poisoning. Okay, next slide. Okay, next slide. These are the number, as I mentioned earlier. It's a 5 times increasing poisoning case due to weights. Okay, next. So you all are advised to study what are the features of the acute poisoning for the nicotine. Yeah. These are example: confusion, convulsion, depression, difficulty breathing, increased salivation. So these are the example of the acute nicotine poisoning. Okay, next. Long-term effect. Because of normally vape is very popular among children, so you need to, and then when they start addicted to it, so it will take longer time to stop. That's why
Nak
to,
lagi
you
ke?
have to, you have to understand the long-term effect of the nicotine. For example, it causes neurodegeneration, promoter tumors, and potentially impacting the brain of the unborn baby. For example, if the mother is actually vaping, so the risk to the unborn baby, increase the adrenaline level, increase heart rate, respiratory. These are the associated risk for the metabolic symptoms. And then the important one is hardening of the wall. So it can cause atherosclerosis. Next. Seterusnya, slide seterusnya. Next slide. Okay, these are the example progression of atherosclerosis. Next slide. These are the potential carcinogenic presence in the vape. Formaldehyde, acrolein, anabasine, metal, nitrosamine, B-nitrosin. And then the nowadays when we did more study, so we'll find more substance, more carcinogenic substance in the vapes. So the number of the carcinogenic is increasing from day to day. Okay. Okay, next. And then another things that you have to understand, the vapors is actually very small. So it's smaller than a cigarette particle. So the size about 100 to 200 nanometers. And then because of the smaller size of the vapors, it can easier being absorbed to the tissue and blood vessels. So that's why, and then another things that the 20% increase in pH in the air after vaping. So I try to study because to understand the behavior of this vapor, because of not much study on this with the Japanese group lah. Cuma belum dapat geran lagi lah. Nak tengok the behavior of vapors. Of course, we want to study the behavior of the vapors. Orang isap vape ni dia punya behavior tak sama with the conventional cigarette because of the vape can be taken at any time you like. So if you just feel a craving, you just take the vape, then you make relief. So not like a cigarette where you have to light up the cigarette, you have to finish the cigarette. Not like a vape where you can just start and stop at any convenient time. Next. So the passive inhalation, as the vapor evaporate quickly. This one also I plan to do a study to see how we understand very well about the particles of the cigarette smoking, but we don't really understand how the vapors move, how long the vapors will stay in the environment, so how much it affected the areas, the room, for example. Then we need to do a study on this lah. Okay, next. This is some studies to show the contents and the effect of the vapors in the vape. Okay, next slide. Another issue is a disease caused by the vapes. One of the thing actually the EVALI. You pernah dengar kan EVALI kan? So in Malaysia, we already have a CPG on EVALI. and I one of the reviewer. So at one time in US, it caused endemics of EVALI, more than 2,000 cases reported. And in Malaysia, from 2019 to 2024, there is a 41 case EVALI reported. And then the problem is most of the severe case need to be admitted to ICU and cost you about 150,000 ringgit lah, for example. So what cause it? So one of the postulation, it could be to the presence of tetrahydrocannabinol, THC, and the vitamin E acetate. So what they did study, they do the follow up. Most of the people who develop EVALI, actually their solution content of these two. So that's the postulation how people develop EVALI, and it's quite fatal, right? Next slide. These are the example patient develop EVALI. Okay, next slide. This is what I mean. In US, there's more 2,800 cases being hospitalized due to EVALI. Okay, next. But now the prevalence is EVALI is actually getting lesser because of they don't put vitamin E acetate anymore. So that's why you didn't see. But of course, because of it is not regulated, sometimes it's very difficult to control the contents of the solutions. Okay. Now come to the issue of vape cessations, right? Uh, but before that, can we next slide? Before we discuss on this, I want to talk about the similarity between smoking and vaping. The similarity both cause nicotine dependence, and then both cause addiction behavior. But in terms of the addiction behavior, we can see the difference between the conventional smokers and vaping. That because of in conventional smoker, they have a pattern. When they want to smoke, they will take the cigarette, they light up, and then they smoke. And normally they spend like 15 minutes to 20 minutes to finish the cigarettes. And then after that, when they start craving, they will take another cigarette, light up, continue smoking, they finish the cigarettes. But for vaping, the device is ready at any time. So you can take like a 1 or 2 puff, then can stop, or you can take it continuously for 1 hour. It's up to you. So that's why I don't know, but my experience, I don't see people who are very craving to the to the vape as compared to how people craving to cigarettes. These are the issues. That's why although at this moment we have no choice, we use the approach of smoking cessation to a vaping cessation, but I believe they are different and they need a different approach. But unfortunately, to date, there is no proper study done on the vaping cessations. Okay, next slide. So this is what we call it a cessation paradox. Cessation paradox means that people who are smoking tend to stop smoking by 51 to 55%. This is based on study. Whereas for vapers, their intention to stop smoking is only 25.2%, half of it. Why? Because they don't feel that they need to stop vaping. Vaping is not dangerous, and sometimes they're actually replacing their smoking addiction to a vaping addiction, and they worried of come back to the smoking because of when they stop vaping. These are the issue, right? That's why I don't know your experience, but based on my experience, the number of people voluntarily come for vaping cessation much lesser compared to those who are smoking, right? Ada komen tak dia? Siapa nak share dia experience? Ramai tak patient datang, jumpa you all nak stop vaping? Ada siapa-siapa nak share? Siapa yang run quit smoking? How many of your
Assalamualaikum,
patient?
Prof. Halmi,
Yeah.
Muhammad
Yeah.
sini.
Ah,
Setakat ni we tak ada receive lah untuk yang apa vapor punya passion, tapi majoritinya konvensional lah.
itulah
Sebab
maksudnya.
majoriti kata ketagih lah dengan vape tu.
Mm.
And then we don't know how to manage properly for ni lah vapors lah.
Yalah,
Instead of
on
apa
our
tu
side we
conventional.
are not very sure kan on the what is the best practices in term of vaping cessation, but on the patient side, not many of them willing to come to stop their vaping addiction, right? Itulah isu dia lah. Yeah. Okay, next slide. Next slide. Uh, what is the what are the available guideline? At this moment, not many guidelines available. The one that I refer is actually the RACGP Oktober 2024 ni. So this guideline are supporting smoking and vaping cessation, a guide for health professional, guidance on smoking and vaping cessation report, support related to change to Australian vaping regulation. Cuma what is the unique of this one? Australia ni dia for vaping dia required prescription. You cannot simply buy the vape in Australia, but the current law dia just amend lah those who less than 20 milligram per milliliter, then you can buy it. But before that, there are 100% required prescriptions. The second clinical guideline is actually by Singapore, published in July 2024. But this one also you can look in these two CPG. This one also not using the base evidence, but they're using basically as I mentioned earlier, based on what are the practices in smoking cessation, and they try to adapt it to the vaping cessations. Okay, next slide. So for vaping cessation, based on RACGP guideline, so you can ask, advise, and help just like smoking. And for Singapore, they use ABC, ask, brief, advice, and cessation support. It's basically the same, but they're using a different terminology. So in every encounter, every visit, or every admission, you need to ask about the status of vaping, document it, and then number of puff in a day. This one is also difficult, right? For cigarette smoking, you can easily estimate the number of cigarette, but for vaping, no one can exactly remember how many puff of vaping they did a day. This is very okay. Second thing, ialah brief advice. Brief advice on the danger of vaping should be given. Okay, the second one, if they want to stop, so provide the cessation counselling for the vapors. Okay, next slide. Ni sama macam smoking lah Pak A ni, asking about vaping and smoking and document in patient record, assessing their dependence and barrier to quit, advising, assisting and arranging follow up. Okay, next slide. Ask berapa banyak they use, what kind of use, how frequency produk, ataupun yang penting nak tanya sama ada is the world smokers, they are still smoking and vaping. Level of nicotine dependence, how long after waking do you vape? Or sama macam merokok lah, within 5 minutes consider very high dependence, within 30 minutes consider high dependence. So we have assessing method kan, screening method for dependency. Next slide. This is what we call it a modified hook on nicotine checklist. Ini yang developed in 2024. I know that Prof. Haniki also developed the modified Fagercom score for vaping. Cuma as I mentioned earlier, walaupun dia modified, but because of we don't really understand the behavior of addiction in vaping, so it's a bit difficult. That's why in this screening methods, so there are 10 questions, and then any yes answer will indicate kan you are addicted to the you are addicted to the nicotine or vaping. The more yes you have, the more dependence. They don't have score like the Ferguson score. So katalah, have you ever tried to stop smoke walking but couldn't? You answer yes, it indicates you are dependent. Do you vape now because it is really hard to quit? Yes. So it increase the dependency level. So this is the one way of checking the addiction to vaping. Agak general sikit lah compare dengan ni, but apa nama, this is what being developed by Australians governments. Okay, next. Okay. What are the general advice? Advise all patients who vape that the aim is to become nicotine free. So maksudnya kan, in your advice to the vapers, so whatever you want to do, make sure that one day kan, mungkin in 3 months or 6 months, you must be a nicotine free. You must provide a very clear advice, but of course non-confrontational lah. So because of otherwise kan, if you say that okay, it is not as harm as a cigarette, so you give the unclear message. So we are not sure about the long-term effect of vaping, but we are very sure based on the content, it might cause long-term problems to the vapers. So these are the advice. The best thing you can do for your health is not to smoke. It's also important not to vape lah, not to smoke and not to vape, because quite majority of the patient are dual smokers. And then in Malaysia, it's not well labeled, and then and often contains undisclosed nicotine and other hazardous compound lah. Ini in our country. Some of the countries that have a very well regulated, then they might have a better report, better what we call it, better labels. So the damaging environmental impact of disposable vaping product may also motivate patient to quit. You can use the environmental factors I mentioned earlier. It causes pollution. Nowadays, and the remaining or the devices, and it causes electronic pollution. It causes chemical pollution and plastic and microplastic pollutions. Okay, next. Next slide. So another thing you can advise that start before the problem of nicotine, it cause a problem in the adolescent brains. So and then in long run, it cause a cognition and mental health. So that's why children, so you can advise their children as well as their parents the importance of stop vaping because of it risks the brains. Okay, next. And then in Australia, they can convert from the NVP, nicotine vape product, to a nicotine-free vaping product before they stop. Maksudnya katalah, let's say kan 3 months kan, you prescribe the, in Australia they use what called NVP for smoking cessation, and for those who are taking vape, they can advise or give the same treatment like smoking cessation, but at the same time they can also give a nicotine-free vaping product. But at this moment, no evidence to suggest that the use of zero nicotine vaping product can prevent relapse to smoking. Maksudnya walaupun this is but being told or being practiced, but it is not supported by evidence. Okay, next. Next slide. Other nicotine weaning strategies, limiting vaping to particular places. You can ask your patient. So don't vape to this situation. Maksudnya kalau you stress, don't vape, for example. You can reduce the frequency. You can limit to the place or situation. This is not to normalize the vaping behavior. So because of vaping behaviors, for example, they can just vape at any place they like, at any time they like. So you can start by limiting the situation, time, and place that they are vaping. For example, don't vape at home, don't vape at the room. This is the way of limiting the vaping behaviors. So you can also extending the time between vape, for example, instead of they can vape continuously or anytime they like. So dia kata dia boleh jangan vape ataupun dia kena tunggu 15 minit or 30 minutes or 45 minutes before the next vapes. Faham tak? Maksudnya dia tak boleh ambil vape at anytime dia like. Kan? Kalau dia cara nak berhenti, maksudnya you can increase the time between the vapes. For example, start with 15 minutes first. When they can tolerate, you increase to 30 minutes to 40 minutes. Another thing is that the strategy to help the people to stop vaping is to avoid the flavors. Some country now, they are prohibited the flavors. So maksudnya tak ada flavor dalam vape tu because the flavors can also make people addicted to that or help them to addicted to the flavor. But in the flavor, there's a nicotine, so it help indirectly people to addicted to the nicotine. So when they want to stop vaping, one of the please find the vape that containing no flavors. Okay, next. Pharmacotherapy for vaping cessation at present, medicine approved for smoking cessation are not approved for vaping cessation. And then those who propose they to use the medication, normally it is off-label and a private prescription. Okay, next. These are the example by Singapore, how to start the nicotine replacement therapy if you wish to start among the vapers. So assess best estimate the nicotine amount taken per day based on known content of the vape device. If you know the amount of nicotine being taken every day, then you can use this. For example, if less than 7 milligram nicotine a day, so you can use a nicotine replacement of 7 milligram over 24 hours patch. If they taken 8 to 14 milligram nicotine a day in the vape, then you can use a nicotine 40 milligram for 24 hours patch. If they are taken more than 15 milligram nicotine a day, so you can use a 21 milligram for 24 hours patch. Plus nicotine 1 milligram lozenges or nicotine 2 milligram gum or nicotine 1 milligram mouth spray. This is what they recommend, but it is still not based on any research. Okay, it's just based on the experts opinions. Okay, next. And another one is a non-NRT, bupropion. You can use 150 milligram for 3 days, 150 milligram BD for 3 to 6 months. And you can also use the varenicline. So, although the evidence for use in vaping cessation is similarly lacking and trial consisting of 12 milligram week treatment, followed by 12 week follow-up for non-treatment phase. Ini based on the RSGP 2022 lah. Maksudnya dia, we can, if you are desperate kan, you can also use the varenicline. Okay, next. So, how to titrate the nicotine vaping products? So, these are the suggestion. Attempting a weaning or cessation and VP after 12 weeks. Maksudnya selepas 12 minggu tu, you can slowly tone down or reduce the numbers. So, and then they use from NVP to NRT. Kan? So, they use a NRT. Then considering of other approved oral smoking cessation, samalah macam Singapore tadi kan. Walaupun dia propose the research needed before it is can be recommended lah. Ini apa nama, some of the they are not comfortable to use a NRT. But kalau Singapore tadi, you can see that they propose the use, but they also there is a disclaimer of there is no trial on that lah. Next slide. Another things that to minimize risk of harm and risk of addictions, kita cadang juga to use a closed system compared to open system. Why? Because on the closed system, the content of nicotines can be controlled. If you use tankers, they use a tankers or third generation devices where you can put any solution you like, any concentration you like. It's very difficult to control the vapors. So that's why we avoid use the open systems. Avoid use free base liquid nicotine at concentration over 20 milligram. Those who use the open system, please avoid to use the concentration over 20 milligram per milliliter, because this considered as a very high addiction, and avoid flavor. These are the recommendation for during the titration phase. Okay, next. Next slide. This is in some country, they use the harm reductions lah. Before slide before. So then you have to discuss carefully, because of in Malaysia, we are not advocate for the harm reduction. So if they want to stop, you must give the time for them to stop. So there is no negotiation. You can still vaping because of smoking is not danger. So our aim actually to make sure that they stop after 12 weeks, similar with smoking. So then we can consider the oral smoking cessation pharmacotherapy, kan? And then normally we don't exceed of 6 months. Maksudnya 12 months you reduce the NVP plus you can try the NRT, and at the end of 3 months you ask them to stop, then you can monitor for another 3 months, or in the places where you can have the non-nicotine NVP, or zero nicotine devices or vape, then you can use that to reduce the behavior of the physical behavior of vaping. Otherwise, if you don't have, then you can just stop after 12 months. Okay, next. These are the these are the general statements. The long-term safety on NVP is unknown. Maksudnya kalau patient you still nak continue kan taking the vape, macam kat Australia ni dia memang prescribe. Jadi the problem is we are not sure the long-term safety. Dual use of tobacco and NVP must be avoided. If patient are dual smokers, then you must stop them because it increase or getting a double risk. People who use NVP have approximately twice the risk of relapsing to combustible tobacco smoking compared to non-NVP user. This one kalau maksudnya if the patient, this is based on the Australian punya scenario, dia still continue the NVP, maksudnya the chances untuk dia relapse ataupun recur to take smoking, conventional smoking is much higher. Saja dia retry another approach smoking cessation pharmacotherapy. Kalau patient yang fail ni kita try tadilah mungkin bupropion, varenicline if they fail NRT for example. Okay, next. Cuma remember tadi tak ada study tak ada proper study supported the use of the pharmacotherapist, but some CPG using. Maksudnya kalau kita nak use, kita mungkin boleh refer to that CPG as our, kita panggil apa as our supported evidence lah. So barriers to quit smoking, one of it is a lack of confidence to attempt cessation. Dia orang takut kan, dia orang dah daripada, biasanya macam ni lah problem dia lah, they are taking the conventional cigarette and then dia replacing to the vaping and they able to stop the combustible cigarette or conventional cigarettes. When they want to stop vaping, they always give the reason that they worried they will come back to the conventional cigarette. But remember, our aim ialah smoke free on vaping free. Use a e-cigarette to reduce stress, that's another reason. And they believe that vaping is not harmful. Most of people because of the design, the devices, tak panas jadi dia tak rasa vaping is harmful. And in mass media, the campaign from the vape people or vape industry, they are selling these ideas like that vaping is much less harmful compared to cigarette smoking. Enjoyment of the feeling and flavor. So some of them they vape because of they enjoy the flavor. Low cost compared to smoking. Relatively now with the technology you can get the disposable vape is very cheap. RM15, RM20 you can get it. The acceptable of vaping in a wider range of places compared with smoking. In some places you can vape at anywhere kan, kat office ke, kedai makan ke. And then it's more acceptable compared to conventional cigarette. So that's why it make people less likely to stop smoking. Okay, to stop vaping. Okay, next. Ni kalau kanak-kanak lah, among young people, peers and social pressure. You tahu sekolah rendah pun dia orang jual vape kan. Siapa yang aware that in primary school people are selling vape around, dia orang balik sekolah tu ada dah yang tua yang tunggu untuk jual vape or sewa vape. Convenient of use, the discretion of e-cigarette and the enjoyment of different flavor, and for especially for youngsters, the flavors, the outlook of the devices is very appealing. And then those who previously quit smoking and continue to vape may fear returning to smoking. This is what I mentioned earlier. And of course, they actually dependence to nicotine. Okay, next slide. I think that's all good. Okay. This is my campaign kan, wiping vape. Okay, ada soalan? I hope I give you some insight on the issue of vape globally as well in Malaysia, and some of the guidance on dealing with the vape cessation, although it is not well supported by the evidence. But at this moment, we have no choice. These are the method that we can try to any patient who want to stop vaping. Okay, terima kasih. Ada apa-apa soalan?
Okay, thank you very much, Professor Hami, for the very informative presentation. So, I would like to open the floor for any Q&A session. So, you can unmute and ask the question, or not, or you also can type your question in the chat box. Okay. So, there is one question from the chat box. Okay. Yang ni tadi.
Slide you all boleh minta dengan Urustia lah. Saya bagi slide tu. Siapa nak pakai, pakailah kan. Untuk presentation boleh.
Thank you, Prof. Thank you. Later we share the slides.
Any question?
Okay. There is one question from the chat box. Okay. Awareness of vaping to school student. Okay. How do you comment?
Okay. Actually, quite a number of group now do this kind of awareness lah among school children because of we notice kan when we discuss with the jabatan apa pendidikan jabatan pendidikan, then they notice the problem of vaping is increasing, especially among secondary school. And the problem is very difficult to notice it, and then for some reason the what we call it the acceptance kan the acceptance is very high, but the effort from the other parties kan, maksudnya kita kat Kementerian Kesihatan, di Kementerian Kesihatan ataupun NGO kan, cannot beat the promotion by the vape industries lah. Vape industry. Macam saya kata tadi lah, in some schools, they are waiting the school children outside the pagar sekolah tu kan, keluar from the fence tu memang dah ada orang tunggu dan dah ada orang supply, and they supply like macam apa ni, kita kata thumb drive je kan, which parents don't aware of it until kadang-kadang kita tangkap ataupun sebab siapa nak check kan kat rumah, kalau katalah that device tu just look like a pen, like apa pen drive ataupun macam mainan kan, and then dia tak berbau kan, kalau dia isap tu balik rumah dia tak bau kan, unless dia are vaping in the ni. So maksudnya the effort kan to create the awareness tu much lesser compared to the promotion of getting vapes. Tu kerja kita lah. FMS kan, FMN ni sebagai advocates to the societies, then we need to have more campaign, more awareness, especially among youth, because of they are really targeting the school childrens lah. That's my comment lah. Buat banyak lah NGO ke kan, buat program among vapes. Saya ada banyak lah guru-guru yang datang jumpa from Johor, from Terengganu pun ada kan. They are designing the module on how to create the awareness and understandings on vapes among school children lah. Okay.
Okay. So, Prof, next question. Salam, Prof. How to determine e-cigarette level inside individual? Because unlike cigarette, which we can use to detect via CO analyzer. So,
The challenges lah because of we don't have apa nama, we cannot use CO analyzer. Even CO analyzer is not meant to measure the dependency or measure the nicotines. Yeah, it is just to measure the behavior of smoking because of the conventional cigarette or the combustible cigarette, the contents of CO, carbon monoxide. Then we measure it because of just to prove that they are still smoking. But we don't know the dependence unless we don't know the nicotine level unless we do a saliva nicotine or blood nicotine or urine nicotine, for example. But that one does not indicate the dependency. It indicates the level lah. Measuring the nicotine is not that important, but assessing the dependency is more important in term of the cessations approach. Maksudnya kalau kita tahu pun nicotine level tu, then does not indicate the dependency, because of kalau you just take the nicotine, then of course the nicotine can be high, but they might just take that one only. Maksudnya dia tidak semestinya dia ambil banyak, tapi kalau dia baru ambil, nicotine tu can be very high lah. Untuk for vaping we can measure the nicotine. We can measure the nicotine, but still it's not that useful for a purpose of smoking cessation. Okay.
okay. So, soalan seterusnya daripada YouTube Live ini. Saya nak bertanya, sekiranya ada kesan terhadap orang sekeliling yang berada dengan vapers. Contoh anak kepada vapers yang berada di rumah.
Hmm.
Sila, Prof.
Okay, I mentioned earlier. So there's a, what you call it, a second hand vapors lah. Second hand vapors lah. I mean sama macam konsep of second hand smokers, right? Where people who are not taking a vape, but they are sitting surrounding people who are vaping, so they can also have the exposed to the vapors kan. And these vapors ni, tu yang saya tengah nak buat study juga kan. What is actually the contents of vapors walaupun dah ada, and then what is the behavior of the vapors tu. Dia vapors kan, yang maksudnya berapa lama dia stay, berapa banyak dia masuk, tu yang kita tengah nak buat study kan, nak tengok the behavior of the, kalau rokok ni the particles lah, yang ni vapors tu kan, kita nak tengok macam mana dia behavior. So how much it affected the people surround them lah. But we believe it affect, but how much and how, so required for the study on this lah. Salam, ada
Okay,
yang
Prof.
tanya ni opinion
Hmm,
on medicinal vape. Apa maksud medicinal vape ni?
hmm.
Boleh saya dapatkan clarification? What do you mean by medicinal vape?
Salam Prof. Saya Dr. Afif.
Okay.
Basically, kalau di luar negara dia apa some country dia dah buat macam vape tu as if macam uh, dia quantified and then dia specifically macam kita kan tak ada legalize
Mm-mm.
on vape punya content kan. Kalau kat sini di overseas tu some country dia ada memang spesifik berapa mg, dia buat study on uh, the vape content. So what is your opinion on that? So
Uh,
memang dia
okay. Kalau I tunjuk tadi tu ada dua guideline kan. Satu guideline on RACGP kan, yang Royal Australian apa nama CPG tu 2024. That one based on the one that you claim tadi lah. Maksudnya in Australia. So people tak boleh ambil vape unless it is being prescribed kan, being prescribed. Cuma yang terbaru ni kalau less than 20 mg they allow you to apa nama ni, to buy from the pharmacies lah. Maksudnya vape tak jual merata-rata lah. Jadi for people who uh, satu, for people who are smokers, conventional smoking, then they want to stop, they can use this NVP dipanggil, nicotine vape products or people who are engaged with the apa nama, addicted to the vape, they can use NVP juga to reduce the addiction. Maksudnya, but dia adalah dia punya formula dia kan. For example, when first people come kan, they will assess the addiction level, then they might prescribe, for example 20 milligram per ml, and then dia ada dia punya prescription of the puff. Then after sometimes dia akan reducekan until 3 months, then before dia transform to zero nicotine zero nicotine vape devices kan. Maksudnya dia turunkan, dia buat macam smoking cessation lah, tapi dia gunakan the vape tadi. That in the country where vape is well regulated. Kalau kat Malaysia ni kita tak boleh buat sebab vape kita ni not well regulated lagi. Walaupun dia ada akta lah yang kawal kan, akta penama kawalan tembakau untuk masyarakat apa tu kan, yang baru tu. But in reality yang banyak jual masih not well regulated. Jadi you cannot prescribe satu apa nama ni, it is not in our approach kan to prescribe vape. Keduanya, the vape that available kan is not regulated. Jadi we are not sure about the content, the concentration and so on. And dia country tu macam Australia tu, dia gunakanlah sebagai one of the approach lah. Tapi kalau you baca lah, dia ada critics on that juga. Sebab banyak juga yang sebenarnya fail, sebenarnya fail, and then the the illicit vaping banyak juga kan. Walaupun negara tu dia, but compared to country where there is no regulation at all, of course the prevalence of vaping tu much lesser, much higher compared to Australia lah. Itu yang digunakan lah sebagai method for stop smoking and stop vaping. Okay. Boleh baca RACGP guideline tu. Okay, next.
Okay, Prof. I think maybe this is the last question. Okay, due to time limitation. Salam, Prof. Lung cancer usually related with cigarette pack years. How and when we screen for vapor user?
Okay. For lung cancer kan, even for even for conventional cigarette, kita tak buat screening because of one, there is no effective screening tool. Second, the effective one, for example kan, yang available and show that there is a good detection rate ialah gunakan high resolution CT scan. So maksudnya kalau you use high HRCT kan, high resolution CT scan, for example in Japan kan, there is study kan, use of HRCT to detect lung cancer among smokers. Even among smokers, there is no certain time when we should start using HRCT to detect the lung cancer. Weight ni lagilah complicated because of course in lung cancer one of the main culprit is the tar. In vape there is no tar, but the presence of some maksudnya in term of developing lung cancer theoretically a bit less because they have no tar, but the other carcinogenic kan, because of tar is not the only substance cause lung cancer. The other carcinogenic kan, PAH kan, can also cause lung cancer. Jadi and the presence of vape in the market kan, mungkin sekitar 2009 kan, yang very widely available kan. Jadi kalau you tanya soalan ni kan, when should we screen for lung cancer, then we are not, we don't know. One, we are not sure screen, and then depending on risk plus dengan how bad is actually the vaping behaviours. Itu pun kita tak tahu. Jadi cumanya kita tak nak lah, when we know, things already late lah. Maksudnya katalah satu hari kita tahu kan, selepas 15 tahun, the risk is increasing, people already exposed to the 15 years of vaping. It's too late lah. That's why the answer is to stop at any time lah. Okay. Terima kasih kepada semua.
Once again, thank you, Prof, for sharing your valuable knowledge and experience with us this morning. Okay. So the organizing committee also would like to thank all participants for your active participation and support throughout this session. Okay, so we hope this session has provided useful updates and practical insight, especially in supporting our effort in vaping and smoking cessation. So with that, we come to end of our session. Let's close our session with Tasbih Kafara and Surah Wal-As. Assalamualaikum warahmatullahi wabarakatuh.
Salam.
Thank
Terima
you, Prof.
kasih. Okay.